If you have back pain with also nerve sensations, so zinging, tingling, numbness,
pain that radiates down the leg.
radius like sciatica, is that they call it sciatica. That's a unique type of back pain, okay? And the nerve is involved, and the most important thing that you need to do today is to stop the nerve from getting irritated. And nerves, can we show them where the nerve is?
Sure.
So can I borrow your back? The nerve, the sciatic nerve, the most commonly pinched nerve in the back, the roots are here in the spine. They come together right about here, and the muscle called the piriformis, they go under to here, and then they split. Two major branches here and there. So you can have pain, tingling, numbness anywhere down the leg, but because the nerve goes from here to there, it doesn't like stretching when it's irritated. So how do you stretch it?
This is stretching. It may feel good in the moment, but it's like itching a scab. Then it's irritated and raw.
We have a lot of patients here at the clinic. We've been doing this for 20 years that believe that kind of slouching or flexing forward is helpful for their pain, back pain with nerve, because it gives them that momentary relief that Courtney's talking about. But on the long run, it's a bad idea. And most likely you're in that category because you're watching this video. If you're also in a program that's giving you a lot of sit-ups and very core type exercises or like tilting, and you have these nerve symptoms, also not the right one for you. Instead, what you have to focus on is making sure you're not doing the activities throughout the day that are causing that pain to perpetuate. The worst of which is?
Forward bending.
The second worst of which is?
Sitting, slumping.
Thank you. Why? Because the nerve is right here at the sit bone. So ideally, find a standing desk or
get up regularly and do what we call a micro break.
So that's a quickie version of how do I kind of decompress the spine and give pressure, or like not pressure, give space for that nerve so it's not as compressed. Can you show it to them?
Sure. You're going to reach both arms to the sky, and then you're going to reach more with the right, reach more with the left, reach more with the right, reach more with the left, one more time right, and one more time left, and then rest.
Easy peasy. So you do those things, you'll start to get, actually in a couple of weeks, you'll start to notice some improvement because you're no longer compressing the nerve, okay? Take your foot off the hose. That's where the problem is.
Yes.
So now, once they do that, let's say they want more. What do they do?
Well, we have a full curated program at mykinetics365.com where we have curated supplements, and actually we have a video on YouTube about supplements that can help with the nerve healing.
Because nerves are notoriously slow, so we do actually recommend some of these supplements because they do help speed up the healing of the nerve. Methyl B, magnesium, alpha lipoic acid, and a type of fish oil. And so they get the supplements. What else can they get?
On the program, we also have what we call a nerve floss. So you're pulling on one end but releasing tension on the other, and then reversing.
You don't want to stretch it like we said.
Exactly. And then we go through fundamentals, so things in your everyday life, how to sit, how to stand, how to pick something heavy up without causing more problems.
To take the compression off the nerve.
Yep. And then we begin to release the muscles that are overworking from all of the things that we do in our daily life. And then after that, we begin to strengthen the muscles that are not working enough.
That's to eliminate the causes of why you're actually watching this video.
Yes.
So
to make you bulletproof so that you don't have this problem come back.
I mean, there's a reason why this happened, and we will delineate, we'll hold your hand through the whole thing. So if you found some benefits from this and you want to explore us more into details, mykinetics365.com. Check it out. So if you like this video and you found it useful, we actually have a specific sequence program that we've developed over 20 years that includes what, Courtney?
So we do start with the fundamentals, how to do no harm, and then we go into a very specific release program, and then after you have learned to release the muscles that are overworking, how to strengthen the muscles that are not working enough. And typically we get people out of pain in 4 to 6 weeks.
Yeah, and there's also like curated supplements. I mean, it's very unique and it's very specific and very sequenced, and it will actually cost you less than 14 minutes a day.
Yes.
So check us out, mykinetics365.com.